Coming up, we bring you up close and personal with three gifted women who carved unique paths in neurosurgery, physical therapy, and performing arts, all to achieve wellness of mind, body, and soul. All of these women are history makers, trailblazers, and pioneers. We've got the profiles on each of them. The Aware Show starts right now.
This original WSRE presentation is made possible by viewers like you. Thank you.
Hi, I'm Dee Dee Sharp, and welcome to this edition of The Aware Show. We're glad to have you right there with us. Today, we introduce you to three extraordinary women who have made strides in their respective fields. What they've done has enhanced the quality of life for generations to come. Who are they? How have their accomplishments impacted our community? And how can their stories inspire you and others? We've got all the answers to this and a whole lot more in this special Aware Profile show featuring not just one, but three dynamic movers and shakers and history makers, starting with Dr. Alexa Canady. At a time when race kept doors closed for many black females in many career fields, one woman refused to give in to discrimination in medicine. Alexa Canady stayed true to herself and remained focused. She received her medical degree from the University of Michigan, and in 1981, she made history as the first African-American neurosurgeon in the United States. She specialized in pediatric neurosurgery, focused on children who simply captured her heart in medicine. Dr. Canady retired and worked part-time at Sacred Heart Hospital until her full retirement in the early 2000s. Over the years, she's received numerous awards for her breakthrough accomplishments in the field of medicine. And now joining us here in the studio is none other than Dr. Alexa Canady.
Hi, how are you today?
You heard all that about yourself.
I almost recognized her.
I was just about to say, after having talked to you, you are so humble about all of this that we just talked about, and we just scratched the surface as to who you really are.
Well, being first was not anything about what I was. I wanted to be a neurosurgeon, and that was the goal. The other came just because of happenstance, so it wasn't a special accomplishment.
Actually, you make it sound a lot easier. You don't just become a neurosurgeon, especially a neurosurgeon who happens to be the first African-American woman.
Yeah, it was fun.
I bet it was.
Yeah.
Tell us about some of the early beginnings. I mean, our time might be a little limited, but I know a lot of people would love to know what your background looks like when we go back to young Alexa.
Well, I come from a family of learners. My grandmother was a professor at Lane College in Tennessee. My grandfather on my mother's side was one of the pharmacists. He graduated from pharmacy school from Meharry Medical in 1921.
Wow.
And my father is a dentist. And so learning was always something of importance in our family.
So it's almost like it is really no surprise that you would at least become a doctor, but then a neurosurgeon.
Well, that was the first pushback I got a little bit from my parents. They didn't really think it would be possible and were concerned that I would be devastated by not accomplishing my goal, because I'd accomplished most of what I wanted along the way. And it was a new experience for me because I'd never ever had any pushback from them. Any kind of crazy idea I had, they would go for it. You know, I wanted to take, when I was in high school, I took a math class, my geometry, and then I wanted to take algebra, advanced algebra as an independent tutorial. This was back in the 60s when it wasn't done much. And they said, go for it. So it was the first pushback I got. But
I'm going to tell you right now, I avoided all of that. Shame on me. But now, you know, in reading your bio and history and all of those things, Dr. Canady, some stories stuck out to me, being an African-American woman as well, and that was some of your uphill battles of racism. And I know specifically one of these events that I'm talking about has to do with you when you were a young girl and you weren't doing as well in school with your grades, and your parents were like, what's going on? Because after testing you, you were off the charts.
Yeah,
Tell us about
it turned out my grandmother was in for the summer, probably to play with the grandchildren, and took a course at Michigan State, and they needed subjects, and she had grandchildren, so we all got tested as part of that course. And the testing that I had showed really very good results. And so the professor took it on himself to talk to my elementary school principal, saying, you got this student here who really has ability, what are you doing with her? And so he pulled out my test from the school, which showed that I was just an average student. And in the course of the investigation of the disparity between those two things, it turned out that my second grade teacher had lied about who the scores belonged to and had reassigned them to somebody else. And she ended up apparently getting fired. But I didn't know the story until I was in high school.
So you were making
my mother was very effective.
I see, in many ways.
Yes.
And so from there, you went on to do some great things at the University of Michigan, I guess?
I went to Michigan undergrad, and I was less than a stellar student because I had gone as a mathematician, planning to be a mathematician, and didn't really enjoy it like I should if I was going to make it a career, and was lost for a while, and that was reflected in my failure to attend class. And then, really because I wanted a car, my brother told me about a summer program that they paid students who were interested in health sciences. And I already had a summer job at the university newspaper, but it didn't start until 5 o'clock in the afternoon. So if I did both, I could buy a car. Cars were cheap then. My payments were $50 a month. So I could make enough money to make the payments for a whole year. And because of that, I found medicine. I worked in a laboratory and I fell in love with it. And it was, after that, there was no alternative. I found something I loved. And that's what you make a life out of.
And now you got probably really nice cars. I'm just kidding.
I have a 7-year-old Acura. Now my husband.
Just teasing you. Just thinking about that money. And
I just wanted, I wanted wheels like everybody else.
Sure,
yeah.
sure. And then even then, after you discovered all of this, you went a step further because neurosurgery was your love.
When you finally decide what you want to do, I didn't really like the heart and lungs. I thought I'd be an internist, most people are. And then I didn't like the heart and lungs to enjoy. And having been through the mathematics thing where I didn't enjoy it, I wanted something I enjoyed. And I found when we had a neurobehavioral science course that I just loved that. I could read that for fun. And so I then began to look at neuroscience and looked at neurology, neurosurgery, and decided that I liked neurosurgery better. It fit my temperament.
Wow. And then from there, you discovered another love in all of this, and that was working with children.
Well, I always liked children.
Okay.
And the thing about neurosurgery was, I know it sounds odd, but when I finished, I wanted to be an expert at something. And it's hard. Neurosurgery to the outside is a small field, but to the inside, it's a big field. And I wanted to really be expert. And so I had to pick something I wanted to be expert at. And when I looked around, the thing I enjoyed was working with the children. I liked their diseases. It's a little different spectrum of disease. And I liked that in the course of the day, I got to play.
And then you were right at home and play with them.
Yeah, playing is part of my job.
Right.
Yeah, to make the kids comfortable with me and confide in me.
When I had the unique opportunity to have you here on the Aware Show and have this interview, I was like, what on earth? I mean, you're talking to a neurosurgeon, I can't even say it, I'm so intimidated. But then talking to you, it's so easy because you seem to be a person who just loves people and is very humble in what you do. And when you think of a neurosurgeon, oftentimes you can think of someone who would have like a God complex. Like you make the difference between life and death with what you do, but you're nothing like that.
Well, my ability to do things depends on your ability to trust me and your ability to talk to me. So I need to learn how to make you talk to me.
And that's something we talked about in the green room even before we came out here to
Right.
the studio. That's a very important part of your patient relationship, your doctor-patient relationship. Talk to us a little bit about why that's so important.
So often people go to the doctor and they have problems and they don't tell him. And then they go home and they say, he didn't fix me. Well, it didn't fix you because you didn't tell him. And yet there's a reluctance to share. And often you don't know what symptoms are important. So it's important to tell everything to your doctor. And it interferes with care a great deal.
What was your favorite case? I mean, is there ever a favorite case or something that just stands
Sure.
out to you?
Things that you
Share
remember.
with us.
Well, I had a little boy who came down to me with a diagnosis of stroke, and something about it just didn't feel right. So we did some MRI imaging, and it still didn't feel right. So we did an older fashioned test called an angiogram, where you actually inject dye in the blood vessels to look at them. And I didn't see any vessels that were occluded like I would expect in a stroke. And so each step along the way, I talked to my buddy, who was my partner, and I said, I think this doesn't feel right. And so we did the angiogram, and it still didn't feel right. And so I finally said to him, does this really sound crazy? But I think we ought to operate on this boy and take a specimen of that tissue. And we argued the pros and cons of it for about the next 20 minutes, and finally we did it. And we found that, in fact, he had a tumor and not a stroke. And so we were able to successfully treat it because we found it when it was still very, very small.
Made a difference.
Made a difference.
Between life and death.
Yeah.
God is good.
Yes.
So tell me.
Trust your gut.
Yes. So what I was just about to ask you, what are some of the things that you've navigated through your career and through your life that you don't have to be a neurosurgeon to take those cues from you and put them into your own life? What would those things be?
I think you have to listen to people. They're trying to tell you something, and you have to be open to what they're trying to tell you rather than trying to tell them something. And I think you have to like to work, and the details matter in work. It's important to get the details right.
And you must really love to work. Because I understand that you retired from the University of Michigan, where you were at the Children's Hospital as a neurosurgeon.
Yes, in Detroit, at the Children's
Detroit.
Hospital of Michigan, yeah.
Okay, in Michigan. And then you came to Sacred Heart part-time.
Well, I actually came to Sacred Heart retired, but because I'd always gone to pediatric conferences,
Yes.
I went. And then they found out I was here, and then in the course of the conversation among the pediatricians, they were very distressed that there was no pediatric neurosurgeon here, and they had some difficulties because they had to transfer many of their patients to Jacksonville. And there were difficulties along the way with that. And so they actually came to me and asked me if I wouldn't consider working. So how can you turn that down?
They're not only asking you for you to tap back into your love of neurosurgery, but also into children. So it was like a shoe-in for you.
And it was fun because I didn't have to be chairman anymore. I didn't have to go to meetings anymore. I didn't have to manage people anymore. It was just me and neurosurgery and the patients, and I had fun.
But it also meant you couldn't be retired anymore.
Well, I did a worker deal, so I didn't work on Sundays.
I gotcha. I could see somebody trying to work that out with
I worked
you.
a deal.
Yeah.
Before I used to work probably 100 hours a week, and I didn't work that hard here.
From just meeting you, you sound like you have a work ethic that is just incredible. That alone could be an inspiration to somebody. But what is next for you? I mean, when you've done all that you've done and you sit here with that kind of background, what are your plans?
What do I do now?
You just want to retire and
Well, I
be done?
spent some time with my husband. He didn't get much. Got kind of short shrift the last 30 years. And then I play bridge. I'm a competition person, so I play competitive bridge, duplicate bridge, down at the bridge club here.
And when you say competitive bridge, you mean it. Like you spend a lot of time doing that.
I spend a lot of time. You have to study it and learn. It's a skill like every other skill, and I like learning skills. Yeah.
Let me ask you this. What would you say to someone who is even an African American or a person who's even contemplating going into medicine and doing a field of study that could impact someone's life as medicine does? What would you say to encourage someone who may be right there, and even a student who's already maybe nursing to take the next level, or maybe a doctor take a next level and go into a specialty? What would you say?
There are very few things in life in which the only goal of your job is to make people better. That's all. And the rest of it will fall in place. And that feels good. You don't get that midlife crisis where it's like, I'm not so happy that I'm really doing well by people. But here, all you're trying to do is do well by them. So it's fun. It feels really good to make people better. And you get an opportunity to be part of people's lives in a way that's much more intimate than other kinds of professions. I mean, I took care of a number of children over the course of their entire childhood, and I became like part of the family. I knew the children and their siblings and grandmother and grandfather. I knew when to listen. Some people don't complain, and I know that even though they're not complaining, they're in trouble. And I knew when people who would complain all the time, I could ascertain when it was real and when it was not. So having an opportunity, and that's why I liked pediatrics, because we take care of people over time. You get to know people, and so you can better serve them.
When you look into the future of medicine, what do you see when you think of technology, when you think of healthcare? What do you see, Dr. Canady?
I think there's going to be a battle and it's started already, to preserve a personal aspect of medicine. It's not just about information. It's about perceiving what a person needs from you, which may be medicine, but it may be something else. And there's a tendency now to give an 18-minute appointment, and so you don't have an opportunity to know the people well enough to provide them with the care they need. So I think there's going to be a battle to take back health care from the billers and from the business people.
Mm-hmm. Because one thing that I can tell about you is you're definitely of that old cliche of, if you don't trust your doctors, you won't get well. And if you don't spend time with your doctors, you don't have time to get what you need from them to get well. That's and right. I'm sure that you as doctors would be challenged if we're not talking to you.
And you won't talk to me if you don't trust me and have a relation. You have to have a relationship with me.
Yes.
It's not just come to see me. You have to have a relationship.
Right, and so you can
takes time.
See some of those barriers that we're talking about right now being barriers to those things.
And
which
everybody
are very
has
important.
different barriers, but you need to be able to ascertain what they are for that person.
And talking about barriers and getting ready to wrap up here, you certainly have faced a number of barriers, perhaps with racism, perhaps with being a female and that sort of thing. Can you tell us a little bit about not just how you were able to deal with it, but how you can inspire others to move past that?
Right. I think you have to not let other people define you. You have to know yourself and understand their problem versus your problem. So you can't give yourself your sense of self-worth to somebody else.
I got you. And so last words from Dr. Alexa Canady here on The Aware Show. What would those words be?
Have fun with what you work at.
Got you.
Yeah.
Thank you so much for being here.
You're welcome.
It's a
been
pleasure
a joy.
meeting you.
Yeah.
Having a jewel right here in Pensacola. All right, there you go. Next up, close and personal, we go to profile a Pensacola native making strides in physical therapy in her Physique clinic. Dr. Justine Williams grew up with a passion to make a difference in her life, and in doing that, she has impacted many others. She graduated from the University of Florida in Gainesville with a bachelor's degree in health education. She later attended Howard University in Washington, D.C., and earned a doctorate in physical therapy. But it didn't stop there. Dr. Williams is on a mission, and it is what she is doing now here in Pensacola that's making headlines and changing the lives of her patients. And joining us here in the studio is none other than Dr. Justine Williams.
Thank you for having me.
Oh, no, thank you for being here, girl. You got it going on.
I'm trying out here. I'm trying. Thank
you have so much going on to be so young.
Yeah.
You are an inspiration just to young people everywhere. Yeah. You never ask a woman how old she is. But this woman's young. Put it like that.
I haven't reached 30 quite yet.
See what I mean? Tell us a little bit about Justine Williams growing up and all of that other good stuff.
So I was born and raised in Pensacola, Florida, to my mom and dad, Walter and Joyce, their only child together. And I had the only child syndrome. Like I had to entertain myself and, just hang out with myself often, and I always saw myself helping other people because I just like to engage with other people. Anytime I got the chance to, I wanted to be around someone else and help someone else. So, I kind of wanted to be a doctor, and I was like, okay, I did the math, and it was like a lot of science and a lot of stuff that I was not good at, come to find out when I got to University of Florida. And then my mom was in a really traumatic car accident, and she did physical therapy. And she was like, you should look at this track and see if you like it. And so I went out to Andrews Institute in Gulf Breeze, and I did some observation hours, and I was like, this is kind of cool. And by God's grace, I kind of got into PT school and then became a PT. And so I enjoy what I do, and it just kind of fell in my lap, if that makes any sense. Yeah. So,
Interesting.
yeah, I love every bit of what I do to help people, and so yeah.
And there's so many different ways to go with this interview with you, and so much limited time. You could do a whole profile on just you because of all the things that you do. I want to get specifically to a few things here. Your physical therapy is a lot different because of some of the modiems and some of the things that you actually incorporate in what you do besides the normal things that we do or we know of as a physical therapist. Tell us about those specifics.
Yeah, so I'm a pelvic floor physical therapist. So it's a specialty that isn't quite new, but it's not quite known. It's been around 30, 40 plus years. And it really focuses on the muscles that you cannot see. Your internal pelvic floor muscles are a 3D bowl. It's supported by your pelvic bone, and it's like if you were inside of it, it's a bowl, literally like a bowl. And not like your bicep or your back muscles or your leg muscles, you know, they're unknown to us because we can't see them. So as a specialist in this area, I rehab those particular internal muscles when there is dysfunction. So that can happen to really anyone, men, women, and children. So I treat children for accidents and bedwetting, things of that nature. Women, pre and postpartum, if they have diastasis recti, if they have incontinence, if they've had radiation and have pelvic pain or just pelvic pain in general, and then men the same. So, you know, it's a very specialized art of physical therapy that makes it different. It makes it very different than the average PT you would get. Yeah.
This has nothing to do with anything, but one thing I noticed when I saw your pictures was I was really impressed with even your physique before I get to your clinic. But I mean, yeah, so I mean, you are what you do.
Yeah.
Really.
For sure.
Yeah.
And I really try my best to take my health seriously because I can't help anyone else if I'm out, down and out. So a lot of the things that I do take strength, right? So if I'm stretching someone's lower back or doing a mobilization, which other physical therapists do in orthopedics, you have to have some form of endurance and good body mechanics so that you don't hurt yourself and that you're not doing your patient a disservice. So at my clinic, I preach a lot about wellness. So we're not just pelvic physical therapy, but it's pelvic physical therapy and wellness. That comes in, diet comes into play, exercise comes into play, but it's specifically tailored to you. So one of the first things that I do when I do an evaluation is a bladder and bowel diary. So that's how much water you took in that day, what you ate that day, how you went to the bathroom, number one, number two. And we get a thorough kind of assessment on how much you exercise, how much you don't exercise, what kind of exercise you do, because all of that impacts your pelvic floor dysfunction. And that goes for anything, right? So if you're, you know, sick or something, the doctor's like, what's going on? Like they do an investigation to see kind of how we got to where we are now. And that's exactly what I do.
And you do that at In Her Physique,
yes,
which you came up with, and it's your business. Tell us about that.
Yeah. So when I was in Washington, D.C., that's where I started my career when I graduated from Howard. I did inpatient physical therapy. I did pediatric physical therapy, but something always drew me back to pelvic floor. It's such an intimate art. It's so different. You get to know the person intimately and really work with them to grow. So when I was moving back home to be with my wonderful husband, I was like, this doesn't exist here. So how can I make it exist here? And he really pushed me to like be an entrepreneur. I didn't know I had the entrepreneur spirit at all. Like if I were to be in a business meeting or something and they're like, give me all your money, I'm like, sure, you can take it. Like I didn't think I had it in me to really have the guts to do it. But with that support, a lot of people actually told me not to do it. Are you crazy? You're so young. Like what? But I took the chance and I opened it, and I found the location that we're at, not too far from where we are now, fell in my lap. Everything just fell into place. But I think the biggest challenge I had was growing that entrepreneurial spirit and combining it with my clinical skills, because it's not the same at all. You can love your patients and help them get better, but that doesn't necessarily pay the bills, nor does it keep you up and running if no one knows you're there. So that's a whole nother atmosphere of advertising and marketing. And it was so many things that I didn't budget for, and it's so many things that I hadn't learned and I still don't know about. So In Her Physique is really my baby that's growing alongside with me as a professional. So it's kind of like the
Wow.
background about it. Yeah.
Wow.
Yeah.
Young, doctor of physical therapy, entrepreneur, and author.
Yeah.
Tell us about your book.
So when comfort can't keep you, basically,
show
when comfort can't keep you, it was actually, I started this book so many times, and I couldn't finish it.
Yeah.
I couldn't finish it. Like, I would put it down, I'd get frustrated. I didn't know how to write a book. I knew nothing about writing a book at all. And I just kept typing. One day I just went to a workspace. In DC, they have like these little workspaces that you can rent out and just kind of do work there. And so I just started typing everything I thought, how can I help people? And I took the different things that I had written before and I combined it with that particular day, and it kind of came into a workbook. So I give this to my patients when they're really struggling with the emotional part of their dysfunction and their pain or their issues. And this workbook makes you work out those emotions. So I give examples of patients that I've seen in the past in here, health professionals or just people I came across, and how they overcame them. And it's a lot of blank pages in here where you just write out things. It challenges your thought processes. And I think this really, really helps people work through that emotional aspect that's hindering you from getting better. Because your body responds to what you feel. If you don't believe you're gonna get better, more than likely, you're not gonna get better. If you stay stuck in your pain, that pain is gonna constantly like remind you that it's there. So this book really challenges that and helps you get through it. If that makes any sense.
Yeah, it makes a lot of sense.
Yeah,
And
yeah.
I like the fact that it's a small read. It's not
Yeah.
a lot there.
Yeah.
So, and then you're saying then that gives you an opportunity also to kind of write your journal, your
Right.
diary,
Yeah.
and work through some of those things and to bring those questions to you
Yeah.
and or other healthcare professionals who can help in those
Yeah,
areas.
absolutely. Because I didn't want it to be long.
Yeah.
Because you get lost in the jargon and all that stuff. It's straight to the point, and it addresses the here and now, right now. Like if I gave you this book, we just had this conversation, I'm handing this to you, go do this homework. When I see you next week, at least pages 1 through 15 needs to be done. So we could talk about it. And I really push my patients to face the emotional part. I see a lot of couples together in my clinic, a lot of moms and daughters together. And it's really a tool that a family could use. Like a lot of people bought it for stocking stuffers at Christmas because it's something that anyone can use, and it's a useful tool for anyone.
When you talk about all of this physical therapy information about pelvic floor for men, women, children, and all this sort of thing, this is not necessarily an easy topic for people to even come
Not at
to
all.
a doctor or come to a physical therapy for. It's a little embarrassing,
Yeah.
you know, so tell us about that.
Oh my gosh. And I think that's one of, I can advertise all I want, but until people see the necessity and value and they're ready to take that step, it really doesn't matter. When a patient finds me, most of the time they find me on Google. So they'll type their symptoms in, or they may have heard of pelvic floor physical therapy or Kegels or something, and then I'll pop up. And then they'll look through my site, do some research, and then they'll give me a call. And they're like, I'm kind of having these symptoms, and I don't really know if you can help me, but I want to see. And then I talk to them and let them know that it's okay. Come see me. Just do one visit. And then once they see the value in it, that's when they kind of conquer that fear of embarrassment. Now, that doesn't mean that's not the same for everyone, because I've seen people 10 times and they're still embarrassed to be in the clinic with another person, period. So they're like, can I get your last slot of the day? Because I just don't want anyone to see me.
Right.
And my goal is to really get women, men, and children to understand that your body's a vessel. It's something that's important. It deserves care. It deserves treatment. And these symptoms and things are not going to go away until you face them. So sometimes we have harsh conversations. Sometimes we have gentle, depending on the person. But I'm very sensitive to where that person is emotionally, and that's where my book comes into play, and that's when my big personality comes into play. And so, it's a safe place. It's a safe place.
And you do have a bubbly personality. Are you like this at work?
I'm like this all the time. They
That's
used to call me
amazing.
the dancing therapist at my hospital because I was always like dancing. That doesn't mean I'm a good dancer, but I dance, and I've been in different places where I didn't have a lot of joy. And so now that I have that joy and I'm effective in what I do, it makes me excited to make a person comfortable. Like when people come in, they're like this, and then they hear me talk, and it's like,
And speaking of hearing you talk, you're also a speaker.
Yeah,
You
well-
go around and do that too.
Yeah, because education is the biggest part of what I do. So pelvic floor dysfunction, what's that? Like, what do you mean? And so that always starts the conversation. And how does that pertain to me? Like, how do I fit in with pelvic? Do I have pelvic floor dysfunction? Is there something I could be doing differently and better? So, you know, I speak on what I do, but also that emotional aspect and empowering women to know that they have resources, empowering women to know that there's hope, because I have a lot of women come in my office that feel hopeless. So, you know, if I can get to someone and let them know that even if it's not me, even if you don't come to my clinic and you go to someone else's clinic or you see someone online, like, you're empowered to go do that. You know what I mean? And that's my goal when I do speak and I do talk.
Mm-hmm.
So,
I see.
Yeah.
So much involved in just seeing that little face of yours. Because I'm like, when I first met you and we're talking, I was like, you're talking about how we'll talk about some of the upheaval. It's things that you have to deal with or have had to deal with to get to where you are. Yeah. The first thing I teased you about is, and seeing you is like, you look like a 12-year-old. I mean, you know what I mean? So, I mean, and then you've got all these credentials.
Yeah.
And experience.
Don't know where it came from.
And wisdom.
Thank you. I actually like the wisdom. I definitely pray for wisdom because it's not something that you automatically are born with. I've really tried to embrace the experiences that weren't good and the ones that were awesome. And I try to let people know that, you know, you go through seasons of life. You go and you have to embrace that season of life. And if you don't know how you're going to make it out, you know, you stay. You stay. And I think it's a song by Donnie McClurkin or something called "Staying," where you just, after you've done all you can, you just literally just stand there. And I've been in that place. And so when I was at University of Florida, and then when I went to Howard, and then when I did my credentials to do pelvic floor physical therapy, I was a different person in almost every single season. But now that I have a little bit of hindsight and I made a little traction in my career, like all of it played a role into becoming who I am today. Every single bad experience, every single good one. And I just want to live my life to the fullest and help other people. My husband's like number one thing is he doesn't want to leave the earth, and felt like or know that he could have done more. And so that it really makes me keep going. Like, I want to do more, I want to help more, and I want to be more and go more and all these, you know, do as much as I can so when I leave that I made an impact. So I think that wisdom, that's wisdom and all that stuff that comes from trying and staying there and becoming conscious of who you are and where you are. Mm-hmm. So that's a lot, but
that is a lot. And I'm saying, like, I know I'm old enough to be your mom, but you have the wisdom of, you know, of people who can live a lifetime and not have come
and I'm so
to
grateful.
knowledge like
I'm
you.
so grateful, and I have so much more to learn. And I love to. Even when we were in the back, I'm like asking questions like,
You were. I noticed that. You could have let Justine do the show because she was out in the green room interviewing all the guests and getting all the, you know, you and Dr. Canady. I was like, break it up. No, just kidding. They were sharing so much good information about your clinics and what you guys do.
It's so
as
cool to have
physicians.
met both of the ladies that were there. But even when I was in undergrad, I was pledging Alpha Kappa Alpha sorority, and they're like, Justine, stop asking questions because you're going to get us in trouble. And then when I went to PT school, they're like, oh, here's Miss Questions again, always raising her hand. But I have to know. Like,
you have to.
It'll
you
itch
should.
me. It'll itch me.
You've got to keep asking questions. It's the only way you're going to keep digging in and learning.
So sometimes I'm like, put a leash on me so I can relax. But
I know that you're a woman in what you do, and you've talked a lot about the fact that you work with women, you work with children, you work with men, but what is it like to do what you do with pelvic floor and this sort of thing with men?
Oh, yeah. Ooh. My first patient was a man, like when I was a student.
What?
And he parachuted out of a plane and, you know, landed on his tailbone really abnormally and had all kind of referral pain to his, you know, scrotal area and like his legs and stuff. And it was intimidating because I was like, I'm really probably, And it was like, I didn't know, but my personality came out. And when I started to talk and really like, no one understands how much power is in words. So like when we started talking and we were hanging out and making jokes, it was an experience for him. And his pain actually started to respond to it. So that's the same with every single male that I treat. They come in my office, they're turning red in the face and like, you know, really standoffish, and by the time they're done, they like coming. And they bring their wives too. So it's fun. Yeah.
I want to just, before we get ready to wrap up things
Sure.
here, I want to give you an opportunity to talk a little bit about some of the challenges that you have come in contact with in getting to where you are now.
Oh man.
I know there are many. Try to isolate.
Yeah, it's a lot. I think the main one is being underestimated and kind of just blown off a little bit, and that could be within the academic setting, you know, at Howard, and also within just this community specifically. We're below the Bible Belt, and it's like when they see this young African American female come in, it's until I start talking and really like expressing what I know and what I can bring to the table, I'm not really considered. And I think that's one of the challenges.
Even now?
Even now.
Wow.
Okay. I think I have to prove myself a little bit more than, you know, some of my colleagues would have. And, you know, I don't mind it. I think I was equipped enough with a mom who's the first, you know, African-American female, the first African-American female judge in our county, you know, just having the wherewithal. That, and then also I think the lack of resources for mentorship. That's really big. And I wish it's almost like I have mentees, but I wish I had a mentor that could help me know things to not fall into the trap of, or, you know, fail in this area. But I'm grateful for the people that have dropped nuggets on me, but it's no one I can really pick up the phone and call and say, hey, like, what should I do about this? Not necessarily in regards to treatment, but into business.
Right. I got you.
You know what I mean? Yes. And so I think those two major things, and again, like we talked about before, the sensitive topic about what I do. Mm-hmm. So those three things combined, I think, but I know that when I stick to, when my husband also always says, when you put pressure on something, it has to break. So the more I keep going forward, those barriers are going to break down. And so, yeah, I'm excited.
I see. And being so young, you're an inspiration to young people everywhere.
I hope so.
Absolutely. What's next for you?
More clinics.
More clinics.
I want to expand. I really want it to be a wellness entity that people come to for almost everything, from empowerment to medical treatment, literally just expanding them. So I hope so. I hope that will happen soon.
I see that in your future.
Oh, yes.
Thank you so much for being here on the You're Aware Show. You're absolutely. Awesome. We wish you much success.
Thank you so much.
All right.
Thank you.
Okay. And if you would like to contact Dr. Williams or find out more information about In Her Physique Physical Therapy and Wellness Clinic, jot down the information coming to you on your screen. And when we come back, our next Aware Show profile guest can be simply defined as art in motion. We introduce you to a unique woman who takes an holistic approach to health, wellness, mind, body, and soul. Beauty, grace, elegance, poise, and wisdom. These are just a few words that describe actress, choreographer, dancer, vocalist, community activist, and ordained minister, Nielah Black Spears. Born in upstate New York, Nielah has been performing professionally for more than 28 years. At age 10, she performed for President Jimmy Carter and the I Am Dance Theater Ensemble. By the age of 12, she was studying with great masters of dance like Earl Fagan, Alvin Ailey, Judith Jamerson, and Debbie Allen. She's toured and performed all over the world, but it doesn't stop there. As an author, her new book, Up From the Mud, Rebirthing of a Lotus, is a wellness tool for the mind, body, and soul. And here in our studio at The Aware Show, we welcome Nielah Black Spears. Thank you for being here.
Thank you so much for having me.
Absolutely. I feel with all of that having been said about you, our last two guests were doctors. I could say Dr. Spears too. No. A little bit further
I take
there.
my hat off to those ladies. Yeah,
absolutely. And to you too.
Thank you.
In your own right, in everything that you've been through and everything that you've done, you are simply amazing. And I want our viewers to know more about Nielah Black Spears. You can tell us from the beginning, and we'll just bring them to where, why we would have you here on this show to highlight you.
Thank you. Well, again, thank you for having me.
Sure.
I just recently released my book, Up from the Mud, which is really a combination of information that I have gained from my childhood to adulthood from master teachers that taught me the power of wellness and the power of healing, and not just physical healing, but mental, emotional, spiritual, and really understanding who I am and understanding that all of them was a part of discovering who I have become and who I'm becoming, because it's constant. Like our dear First Lady, Michelle Obama, talks about becoming. And so that's me, just really, really coming to a place where I've come to understand that I am constantly evolving, and I'm a part and piece of all of these great people who have imparted in me, from my mother to my grandmother to all of my great dance teachers, from Garth Fagan, who produced The Lion King, to Alvin Ailey, Judith Jameson, Debbie Allen. These were all people who, by the way, who I did not know were famous when I was taking classes with them, because we were just young kids in the ghetto having the opportunity, not knowing this great opportunity to have these free classes to learn an art form that will one day,
from the best,
right?
Some
from
of the
best,
best.
right. Had
Yes.
no idea,
And not just one,
right?
but four,
right, and more
amazing.
of people that we didn't know, and so yeah, like so in that, having the opportunity to travel and to see the world, and the world became my teacher. Going to other countries and other continents, and being face to face, not just as a performer, but as a wellness instructor. I'm a health and wellness instructor. I'm a Reiki master. I have many certifications. I have my degree is in performing arts, in dance, in technology, and performing arts, and theater. So with that, I've had the opportunity to travel. And on my off seasons, I would go and take a class to learn about Buddhism, or to learn about physical healing with the assistant to the Dalai Lama. So I've had great experiences that I know are unique for a Black woman in America, because I've been places and I felt like I was the only Black person in that whole country.
Interesting.
And it was great, because there was no. What it did was it helped me to really, really, truly stand firm in who I was becoming. And so whenever I would come back to the States, and I would share my experience with people, I understood that it was a unique experience, and people would kind of pull back some and say, well, that's great. But it was my experience to learn. It was my experience to understand. And so through that, and some traumas, through accidents, and I had a
I was getting ready to say, I know you don't think you're just going to scrape
Right,
by that and
right.
just go, no. Put the brakes on. Okay, let's zoom in and focus. So you're a survivor.
I'm a survivor
Of 3 car accidents.
3 car accidents, starting from the age of 3. I had a car accident. I was hit by a yellow school bus. Actually ran over me, but I just happened to not get ran over by the wheel.
Wow.
Right. And so my family tells me that story all the time, chasing after my aunt who was on her way to school, and I ran out of the door before someone could catch me on a busy main street.
Oh my goodness.
So yeah, and then the last accident was actually here in Pensacola, and it jarred my spinal cord to where I had 2 herniated discs. And anyone who knows about having herniated discs,
yes.
it's very painful. And I'm a mother of 3, and I've had 3 children with no anesthesia, from a 8-hour labor to a 13-hour labor to a 3-day labor, with no anesthesia. And I could not even still compare the pain to the herniated disc, to where I was paralyzed on one side. And the awakening for me was when I was in Southeast Asia and almost died from food poisoning, lost 16 pounds. And I'd stopped, actually had started writing the book, and I stopped because I got really discouraged. And I decided that it was time. It was time for me to put my story forward, because I survived that. I was like, if I make it home, because I was sure that I was going to die in Southeast. It was that bad. And I said, well, if I make it home, I'm gonna finish this book, you know.
And you keep talking about the book.
Right.
I want you to hold it up so the viewers can see
This
the
is
rebirthing of a lotus.
The rebirthing of a lotus. So outside of my room was a lotus pond. And I had never seen lotuses in real life before. I've learned about them through my classes that I've taken with Queen Afua, and who is a world healer for women. She focuses on the womb. And after taking classes with her, going to the Queen Afua Institute and graduating from that, I learned that the lotus was very significant in understanding the cycles of life. In Southeast Asia and in India and other countries, the lotus is actually used as a symbol of rebirth, because the lotus goes into the water at 4 a.m. It goes back into the mud, because it's in a pond. It's usually in like little ponds, and it goes back into the black soil, and it comes back red, purple, pink, gold, yellow, the most beautiful flower in the world. And its stems are the strongest, its roots are the strongest roots in the world. And that lotus became a symbol for me as a Black woman who has dealt with so much trauma from, I've been in abusive marriages. I've had a marriage that was very abusive. When I came to Pensacola, I was in a homeless shelter. I was homeless. I stayed in an abandoned house. Just a lot of trauma all of my life. I saw trauma.
You're a cancer survivor.
I'm a cancer survivor.
Yeah.
And so I dealt with a lot of just different awakenings and shakenings in my life, where I had to find out why, why am I going through, with all of the wonderful experiences I've had in my life, why am I continuously going through this trauma? I'm an ordained minister, so I grew up in the church and, was laying hands, and we were praying and fasting and all that, but I still kept having trauma. I kept going back to that space because I needed to dig deeper. I need to truly look at there's poems in between the lotus. There's tools in the book that teaches you how to become consistent and disciplined in your process of healing. And in between the tools are poems, and one particular poem talks about looking in the mirror from the inside. And so when I discovered that I needed to examine myself as the doctors were examining me and either not finding anything and as to why I was having all these symptoms, or finding things and not finding that I'm having the symptoms, having the issues that I'm having, I had to look deeper within myself. And when I did that, it then helped me to say, okay, I need to get to the root of why I'm having these traumas and let go. And when I started to let go, that's when I began to embrace healing, and I began to be empowered with healing. So I was the person that was in control of my healing, not the doctors, not the medicine.
Yeah, and I wanted to go into that because that's a part of what you're all about, is self-healing.
Yes.
Tell us a little bit about that.
So the self-healing is truly about, like for instance, when I was diagnosed with the cervical cancer, after I had my second child of three children, I had to go back to the trauma. And where did the trauma happen? Where did it start? It started when I was molested at 3 years old. So that trauma happened long before I had a child, before I was, sexually active, all these things that were happening to me. And where did that come from? And then I had to go to a place of forgiveness. I had to really come to a place of digging deep and tearing back the layers and understanding that, guess what? It was also generational. It was something that happened before, over and over and over and over again, right? So I was just one of many victims of this trauma. But I was the one who was called to actually, deal with it in a way that my family hadn't dealt with it before. And that was really getting to the root of saying, okay, this is time. It's time for me to forgive what's going on the inside of my body, so that my body can then relax and begin to do the work. Because I can take all the medicine in the world and it may put a cover or a Band-Aid over it. But if I remember or go back or create an opportunity for it to come back by either mentioning it or having an argument about something or passing it on to my daughter in some way, shape, form, or fashion, by repeating the cycles of having that same type of relationship or bringing that relationship into our lives, then it's a repeat of the trauma. So it's more of an emotional awakening that you have by really understanding that you have to deal with the why. Why is this happening to me? And then it's the foods, and then it's the things that you're doing on a daily basis, the exercise, right? Even to the clothes that you wear, wearing natural fibers, making sure that you're wearing silks and satins and wools. In ancient times, that's what they did. They wore natural fibers, things that were from the earth, right? And so that was another thing, because when you take something into the body, you're dealing with the organ that's the largest organ, which is the skin. And so anything that goes into the body, it has to be able to absorb it. And so if you're wearing unnatural fibers, then it's creating blockages, again, another blockage, and it's not able to absorb all that you're taking in. So I went to a very deep place, and all of this was taught from many teachers that I have had the privilege of being introduced to in my process of healing, because I was in deep search of living my life to the fullest, and that means truly finding happiness from within and not from someone else, because that's another trauma, right. Pulling from someone that is not capable of giving it to you, right? Right. Yeah, and so that's the thing that I had to do, and again, some of these things are in the book. I talk about the natural fibers. I talk about the foods. I talk about making your own juices and, exercising. And so all of these things I begin to incorporate, and it's my life. It's what I do for a living, and it's a way I help other people. Besides performing, it's another way in which I help others to grab a hold of their own process of healing and continue to do the work.
You are absolutely amazing. I first came in contact with you a couple of years ago with Al Martin and Friends, and having seen you dance. It is just extraordinary that you can even move like that after having been through some of those physical traumas that you're talking about. That in and of itself is an inspiration.
Thank you.
And then to have had the kind of background you've had with some of the best in the world in your training and that sort of thing. It's like you're saying none of that's going to go to waste, because there's a will, there's a way.
That's right.
And you're proving that it can be done. Tell us a little bit about PB&J, the company.
Well, PB&J is a nonprofit organization that was started here in Pensacola during my time here. And again, it was started through the love of the arts, the love of performance, but also the love of sharing it with young people in a way where they can come, like I did, to a space that is safe, a space that is full of culture, multicultural, and things that they can do to help to bring out the creativity within themselves. So we create these platforms for local artists and create an opportunity for self-development and artistic development for international audiences. And so our goal is to, we've been doing summer camps, dance and drum summer camps. We had an after-school program. We actually had a after-school program, and Dr. L. Martin was the director in the beginning. Before we did PB&J, it was another program that we did before that called the Action Center from Brooklyn, New York. So we started it there at the elementary school, And then we branched off, and now we're at the Voices of Pensacola. And we do that. We've been doing it every summer. We didn't do it last summer, but we're coming back this summer from June 12th to the 16th. And so, yeah, it's a great opportunity for not just young people, but for people who have a love of art and performance. And so, yeah.
I kind of jumped out there because I know what it is, but I'll let you tell our viewers. What does PB&J stand for? Because we think of peanut butter and jelly.
Right. Yeah, and that's why we created that name, because
Right.
it's memorable. So it stands for Performance, Blessings, and Jazz. So and jazz is a play on word, you know, thinking about New Orleans and the gumbo of the arts, because it's a conglomeration of all the facets of the arts coming together.
And where will we see Nielah Black Spears in the near future?
Well, I will actually be, I'm actually on the book tour. I actually just came from San Francisco, and I'm on my way to Alabama, as a matter of fact, to do a retreat for women, and then I'm off to Belize to do another holistic wellness retreat. And I'm coming back in June to do our summer camp and hopefully, a lecture on the book.
Very good.
Yes.
All right. Well, listen, we wish you much success with everything that you're doing.
Thank you.
I would be remiss if I didn't give you just a 30-second opportunity to tell us about being a high priestess and a minister.
Okay. Well, I am an ordained minister. I was ordained back in 2005, along with receiving my certification as a holistic health and wellness facilitator. I'll say that. And then in 2016, after tracing my ancestors, my mother's family are the founders of Togo. I did its very extensive DNA testing, went to Nigeria, went back again, and found out that they were Yoruba, people from the Yoruba land. And so therefore, I then followed my ancestors now, and I am a priestess of the Yoruba tradition.
And I love the fact that you knew to go find out who you were so that
Yes.
you know who you are.
Absolutely.
And I do too now.
All right.
Thank you. And if you would like to find out more information about Nielah, grab your pencil and check out the information coming up now here on your screen. Jot it down, check her out. And that's all the time we have for now. I'd like to thank all of my guests for the show, Dr. Canady, Dr. Williams, and Minister Nielah Black Spears, not just for being here on The Aware Show, but for making a significant contribution to our history and for being inspirational women to all. We wish them much success, and I'm sure you do too. Be sure to catch us on WSRE.org, and you can also check us out on YouTube and WSRE at Facebook. I'm Dee Dee Sharp, saying until next time, stay informed and stay aware.